to understand from you, in terms of patient safety and quality systems in the healthcare institution, what progress have we made? And at this point in time, in the present day, what is the situation like, and where are the gaps, and where do you see patient safety going in India?
You see, quality in healthcare and patient safety, they are synonymous. They are the two sides of the same coin. Now, quality, if you ask me, is driven by three factors. One is that you drive the quality or patient safety through regulation. And let me tell you that healthcare needs to be regulated and is regulated. So, regulator can always impose conditions that hospital or doctor or clinic has to do 1, 2, 3, 4, 5 things. Otherwise, regulator can stop the healthcare service. That is one aspect. Second is, which is more prevalent in the world over, is through payers. That means you incentivize hospital that if their indicators or the outcomes are better, then they are reimbursed on a higher rate. That is what is done. Most of the developed country, like in USA, if the hospital is not accredited to quality standard, they do not even impanel them. Okay? But in India, we started this journey of quality, if you remember, in 2006, when we launched the accreditation system. And you must also understand how this got initiated. This got initiated because India was getting good number of patients from other countries starting from 2000, and then the demand came that how should they choose the particular hospital, and that is where the Ministry of Health, they approached us. I was in Quality Council of India to develop the accreditation standard, which is of the international level, and we did it in 2005 and 6, and so that is the starting of the quality journey in India. And Government of India, like CGHS, ECHS, all these schemes, if you are accredited to our NABH standard, then these hospitals were reimbursed or are even being reimbursed even today 15% higher. So that is the simple way of incentivizing or driving quality. And today, I think more than 10,000 hospitals are already accredited or certified. And this journey is continuing. And more payers, when I am saying payers, insurance company, state government health scheme or central government health scheme, they are all relying on the accreditation and paying the reimbursement higher. So this is where we are today.
Right. In terms of accessibility of healthcare and affordability, what are the challenges there? Where do you see, what solutions do you see to solve that puzzle?
Okay. So there are two aspects. One is called availability of the healthcare and another is called accessibility of the healthcare. When I am talking availability, that means you should have requisite number of hospital beds, requisite number of doctors, requisite number of nurses and paramedic staff. In terms of availability, our estimated figure, which Association of Healthcare Providers India has worked out, is coming 1.8 beds per 1,000 population in the country, while our target should be 3.5 beds per 1,000 population. So we are still, I think we have to do double the number of beds to reach the WHO norm. Second, what you asked me, accessibility. Accessibility means that patient has got the healthcare establishment in terms of primary, secondary and tertiary care within the reach. Now that is where we have a problem. For example, in Telangana, we have got, let us say, 126 hospitals with 100 bed and above, out of which 118 hospitals are in Hyderabad alone. That means remaining all districts of the Telangana do not have any tertiary care. Second is, we presented a study to yesterday, in fact, here, that let us say in Karnataka, we have got 4.2 beds per 1,000 population. Good number. While Bihar has got 0.3 beds per 1,000 population. So you can understand that how poor is the healthcare services in state like Bihar. Some other states also have got poor, but not so poor as 0.3. So this accessibility and availability are very important factors, and we have to now ensure that either the regulator or the government should now promote those districts where there is no health care, or at least there is no tertiary care. So this is what actually planning should be done, and this study Association of Healthcare Providers India is submitting to Niti Aayog.
Absolutely. Well, that's great. That's great. In terms of people are saying that we have always had this manpower shortage in terms of doctors. So telehealth has come in a big way to solve that. And there was a doctor just now, and he was talking about that we are lacking super specialists, and now with the help of telemedicine, a patient sitting in the remotest place can access a DM doctor. But do you think enough infrastructure is available at this point in time from the government side, or do you think the government also needs to invest enough in telemedicine to kind of shorten this?
I think I keep saying this point, that in spite of the best of the telemedicine, you need basic infrastructure, physical infrastructure available at the different locations. Similarly, you need, if not a specialist, at least you need the normal MBBS doctor or a experienced nurse who can connect the patient from the remote location with the specialist. So I think this is not good enough that you have a specialist sitting in Delhi and somebody in Darbhanga patient. How do you connect with him? So I think we first need to bring the good primary health centers across India. We have got, I think, 25,000 primary health centers are available, but they are not equipped. Number one, they do not have the requisite, even the nursing staff. So firstly, we have to build the basic infrastructure, and then this telemedicine, teleconsultation will work.
Absolutely. Thank you so much, Dr. Gyani, for joining us.
Thank you. Thank you very much.